Welcome everyone to the monthly focus. And now, here is our host, Milan and Lolo.
What's up, everybody? How's everybody doing tonight?
All right, let's get started. Tonight's monthly focus is about opioid awareness.
And we'll start with our sponsors, starting with Delaware Prevention Partners
The Planet Youth Coalition.
and the Kids Department.
And now we have tonight's show, starting with Who's in the Room,
Meet the Crew,
tonight's goals,
What is an Opioid,
Ask the Audience,
Video Break,
This or That with Adam and Alana,
Interview with Joanna Champney,
Did You Know,
Video Break,
Safety Tips for Handling Medication with Miss Hayat,
Outreach Moment with Elena.
and Join the Crew/Follow Us.
Okay, so Who's in the Room is basically a chance for you, the audience, to shout out a club or an organization that you're in, or maybe just you. So, who's in the room?
The Cause.
Cause.
More than fitness.
More
More
than
than
fitness.
fitness.
Okay, who else is in the room? Dad's on duty. Okay, who else?
Nova Community Center, Moms on the Move.
Mom's on the
We
moon.
got dads and moms tonight.
All right, anyone else? Anyone else?
What was it?
Bellefonte
Bellefonte
Lions.
Monthly purpose.
And now we have Meet the Crew, basically when we shout out our own crew members who are here to help us tonight, starting with Ethan, Adam, and Jacob on camera,
And we have Alana, Elena, and Clave on Switcher Switcher.
Clave.
All right. Now we have tonight's goals: to educate about prescription drug use and misuse.
And how to properly dispose of prescription drugs. Now we have What is an opioid? Opioids are drugs that occur naturally in the opium poppy plant. Some examples are heroin, fentanyl, oxycodone, and aspirin.
How the misuse commonly starts. Painkillers. Tolerance can develop surprisingly rapidly, even in cases of acute pain. Clinical evidence of tolerance can be seen within just a few weeks. Moreover, the apparent need to maintain long-term opioid therapy following on an acute injury is not a rare phenomenon.
And now we have Ask the Audience. How has the opioid crisis impacted you, your family, or your community? All right, raise your hand if you're ready for me to come to you. Use Mr. Scott? Okay.
There are people in my family who have become addicted to opioids. One in particular was a very prominent family member who is a lawyer, and he had a back injury. And while on the back injury, he began to use Percocets and oxycodones, and eventually became addicted to it. And so it did take a long time, but he is now in recovery. But what was really surprising to me about it is that sometimes when we think about people who are maybe using opioids, we might have a perception of what that person looks like. But I learned that this is the kind of disease that can affect anybody, wherever they are, whoever they are, doctors, lawyers, just about anyone. So that's one of my opioid experiences.
Thank you, Mr. Scott.
Thank you.
I was born in West Virginia, and West Virginia is famous for coal mining, and coal mining is a really, really hard job, and you get injured often. And Big Pharma targeted West Virginia with convincing doctors that these opioids were not addictive, and so they started handing them out to miners who were in pain, and they promised them this would not get them addicted. And over in one little town, I'm talking about 300 people, over 9 million pills were provided to that one small drugstore for the purpose of keeping people in pain and addicted and making Big Pharma lots of money.
Thank you.
I was in an automobile accident, rear-ended by a drunk driver when I was 20 years old, and I have 4 herniated discs in my lower back. I was sent to pain management and was given a huge amount of pain medication, oxycodone, methadone pills. And then the doctor's office was investigated and shut down, so I no longer had a place to get my pain medication. So I was dependent on it and addicted to it. So, but I am now in recovery for 10 years. So,
Wow, thank you.
Hello, my name is Sol Robles, and just like with Miss Heather, I live in a community that is actually struggling with opioids. And I was asked to work in my community of Knollwood because of the needs that are there for the same thing and how it's impacting our community. So the passion was to advocate for the community, to present the community to our officials and so forth, local communities, to say how can we help because the impact has been so strong. The goal, my desire and the goal for the community is to continue to bring partners, but also how I can help my own neighbors. And so I'm glad to be here because this is one of the topics that we are now discussing within our community and families and the kids. So I'm glad to be here as well.
Thank you. Thank you.
So it's actually a personal story. My father worked in a factory in Queens, and he was run over by a forklift in the middle of the job. And he went on disability, countless surgeries, really messed up his back, and he fell back onto opioids. And he was on almost every single one, and he could barely get out of bed without taking a pill. And it wasn't until we moved maybe like 4 or 5 years ago that he was able to kick the stuff. And he was really, really proud of himself that he doesn't need a pill to get out of bed in the morning. So.
Thank you.
Thank you, everyone. Thank you to everyone who answered these questions,
Yes.
because we get that it's a really heavy subject.
All right. The upcoming opioid awareness videos are created by our amazing interns, Aaliyah and Adam.
Enjoy.
In recent years, a silent epidemic has swept across our nation. Opioid addiction has devastated families, communities, and lives. The toll on loved ones is immeasurable. Parents, siblings, and friends watch helplessly as their loved ones succumb to the disease. Seek help if you or someone you know is struggling, and support organizations working to make a difference. Together, we can break the cycle of addiction and create a future free from the devastating effects of opioids. In recent years,
All right. So now we have This or That with Adam and Alana.
Well, hi guys.
Hello.
Are you guys starting to have a fun night?
How's the food?
That's good. So, ah, that's good. So here we are going to be playing This or That. So this game is basically about would you rather, but different. The only different thing is every time when we pull up a picture of an image, you're either going to say this or that. And this theme is going to be school, because Adam is going to college this upcoming Monday. And I will be starting up my senior year of high school this coming Monday. Alrighty, let's get started.
Math.
Or science. I'm not really hearing you guys. Could you be a little louder?
I'm hearing a lot of that.
I would pick that too, actually.
Yeah. I hate math.
Math is not my strong suit either. So.
Art.
Or music. Okay.
I'm hearing a lot of this.
But what would you choose?
I would choose that because I feel like a lot of people know that I am a very huge music addict.
I would choose this because I love to draw. A lot of people know that about me. I love to draw. School buses.
Or the public bus.
Okay.
A lot of this.
A lot of this, I hear.
Okay. Football.
Or basketball.
Well, that was immediate.
I need you guys to be louder.
I feel like that is a bit louder.
What would you? Yes, that is a bit louder because it's sport. Now, what would you choose though?
I'll choose that.
Okay. I can understand that. Okay.
Summer break.
Or winter break. Okay, wait. I would like to say something as well. I know winter break is a little bit shorter than summer break, but for my own opinion, I feel as though it's about, do you guys like summer hot better or do you like cold better?
I feel like everyone likes the summer.
I like summer. It's definitely summer. I hate the cold. Alrighty.
Okay. Reading.
Or writing. Okay.
A lot of that.
But what would you choose?
I think this.
I would choose that. I like writing at times, but I also like reading at times.
I used to be a writer, but.
Okay, so I would like to explain this before everybody screams, right? So at my high school, we usually have like this little competitiveness over choir or band, and we try to either have a competition to see who is better, choir or band, or we kind of just like say choir's better all the way. So what I'm asking you guys is choir
Or band.
louder!
I'm hearing no answer.
I hear no answer too, but for me, I will always be a choir. Lead. Okay, so regular pencils.
Or mechanical pencils. I knew people were gonna choose that.
Okay, but what would you choose?
That.
Really? I mean, I don't mind either or, actually. I would be fine. But mechanical
so do
pencils
mechanical,
break
yeah.
even more. Fair.
Yeah.
Fair. Alrighty.
And now we have the interview.
Yup. Oh, well, here you go.
Hello everyone, how are y'all doing tonight? That's excellent. My name is Jacob. I'm a member of the Cause production crew. I'll be heading off to college also next week. At the University of Delaware. Go Blue Hens! But today we have a very excellent interview prepared for you today. I have the honor of interviewing Joanna Champney. She is the division director of the Delaware Division of Substance Abuse and Mental Health. I believe it's also known as DSAM. Is that correct?
That's right.
A few days ago on the Talk About It podcast, which I just finished up serving as host and producer of, I actually interviewed Joanna. We had an amazing conversation about addiction and about opioids and kind of like a microcosm of what this monthly focus is about. But Joanna, it's great to be here, and I want to kick off this interview by zooming in specifically on Delaware. What statistics and stories do you know about addiction and opioid use in Delaware?
Well, Jacob, thanks for having me, first of all. I'm really happy to be back. We had a great time on the podcast, and I really couldn't wait to come back and join you guys this evening. And I want to thank everybody for sharing the incredible personal stories of how this issue has impacted you. So we've already heard a little bit about how this issue is real for so many Delawareans, and I can certainly provide some numbers to put it in perspective. So last year, 2023, we lost 527 Delawareans, to either drug poisoning or accidental overdose. And I say drug poisoning because of something I'm going to address a little later on, which is that you often don't know what is in the drug supply. And so that's why we say drug poisoning, because the individual was not intending to overdose. The amount they took normally would not have resulted in an overdose, but it's because people don't always know what's in the substances they're taking that happens. So the year before, we lost 537 people. So a difference of 10 people. I mean, we're heading in the right direction, right? 10 fewer people. Many other states, especially those states on the west coast of the U.S., their numbers are continuing to increase. And so we are really glad in the Northeast that we're starting to see a downward trend. But we will not be satisfied until that number is at 0, right? Until we reach everybody who has an addiction issue, and we make services available for those people. So heading in the right direction, Jacob, but certainly not where we want the number to be. And one of the issues that my division really struggles with is ensuring that people can get access to treatment. And I know you want to talk about that in a little bit, but I do just want to talk about the numbers of people who may need treatment who don't have insurance. I'm sure you all have had to navigate this in your own lives. Often your healthcare decisions are driven by what kind of insurance you have, which provider will accept your insurance. And so for people who don't have insurance in the state of Delaware, that's considering people who don't qualify for Medicaid or they don't have employment that offers insurance. There's about 13 to 14,000 people in the state who are uninsured who may have an addiction issue. 13 to 14,000 people in the state who have potentially an addiction issue who don't have insurance. That is a lot of people who need to access care. Now, not all of those individuals are currently being referred to treatment and accessing treatment, but when we look at the numbers of the prevalence of addiction and opiate use in particular, the number is really high. And so our division works really hard to make sure that we have free state-funded treatment in all 3 counties at all levels of care. So we can get into that a little bit later, but by the numbers, about 13 to 14,000.
That is unfortunate. And when it comes to opioids specifically, I know that sadly tens of thousands of Americans per year have lost their lives to opioids. But when it comes to opioid addiction and substance use disorder versus addiction to other substances, are there any differences in terms of the social or medically speaking? Are there any differences between opioids and addiction to other substances?
Well, a couple of things that I want to highlight about opiates in particular. One is something that we already heard from your audience earlier, which is the pathway into addiction often is begun through an injury, and so an opioid may be legitimately prescribed, and then that individual gets hooked on that substance and then may start to obtain that substance through illegal means, like illicit substances. And the danger with that is that it can lead to addiction to heroin and other similar substances. So the pathway often begins as an injury. The person is prescribed an opioid, and then it gets out of control. So that's something that I think is somewhat different than the other recreational substances that we often hear about, that pathway in. And that is why, because of the injuries, which we often see in the construction industry, people who work construction, I think I heard a couple people mention that, we have developed some toolkits for construction industry employers to help educate their workforce about the dangers of becoming dependent on opioids and where that can lead. So we have our toolbox, pun intended, our toolbox toolkit that's available on the Help Us Here website. So please spread the word if you know people who work in construction. It's a great way for foremen and other people who work on those jobs to spread awareness with their employees about how to navigate that, and if it becomes a problem, where they can get help. Another industry where we see a lot of individuals who have overdosed having been employed is the restaurant industry. So we have our Restaurant Accolade program, which you can also find information on the Help Us Here website. We are getting ready to launch a video that talks about that program. And really what we're trying to do with that, Jacob, is equip restaurants to help their own employees because addiction is fairly prevalent in the restaurant industry. We also have had a number of situations where people have come into restaurants and unfortunately overdosed in the restrooms or sitting in a booth. That can be a really scary situation for someone who's working there. So we want those restaurant employees to understand how to respond to their overdose. And so the Restaurant Accolade program trains the restaurant workers on how to utilize Narcan. If you haven't heard of Narcan, it's an overdose reversal medication. Something that you basically kind of squirt up the nose, little puffs, and really easy to administer. If you are interested in getting trained on that, we have trainings regularly all throughout the state where the training is free. They're offered all different days of the week, hours of the day. You can sign up or just show up, and we give out the free kits and also show you how to use them. If you would rather not go to a training, maybe you want to keep it anonymous, go to the Help Us Here website. You can actually order it by mail, no charge, and we will mail it right to your door. It is crucial that we get Narcan into more hands. So last year alone, we distributed more than 32,000 units of Narcan, which this year we're set to far exceed. And so we're really targeting zip codes in the state where we see higher rates of overdose because we really want to saturate those communities and make sure that they have the tools to save a life. And then the last thing I want to mention is the risk to youth when it comes to opioids, right? So that, I believe, is also unique to opioids. The likelihood of teens taking pills that they believe are prescription pills that their buddy or, they stole out of a parents' friend's medicine cabinet or whatever, that does happen. And so the real danger with that is people think they know what's in the pill, but they often don't. And so you may have heard about the One Pill Can Kill campaign, and that is absolutely true because of substances like fentanyl, xylazine, bromazepam. There are some really scary substances in the street drug supply right now. And so we really want teens to be empowered to make smart choices. You often cannot trust where the substance came from. It is never a good idea to take a substance that you were not prescribed by a physician that you obtained from a pharmacy, even if you think you can trust the person who's giving you that substance. And so the One Pill Can Kill campaign helps teens to really understand the dangers of fentanyl. It is such a powerful substance, and really one pill truly can kill. And so we want to get that information out for school administrators, parents, caregivers. If you have a child or a teen in your life that you care about, I really encourage you to visit the Help Us Here website and check out the toolkit we have for how to talk to children and teens in your life about drug use. It has a lot of really great one-pagers that you can download and read. I have 2 young adult kids, one 18-year-old who's about to start UD also, and I've used it with my own kids. We've talked about it, and it's great. I mean, I work in the field, right? And even for me, it can be hard to have those conversations. So I really do recommend that for anybody who's interested.
Joanna, you've given us so much insight into addiction, into opioids. But for my final question for this interview, I want to focus on treatment. I want to confront this head on. Let's just say that someone who's experiencing an addiction or substance use disorder was standing in front of you right now, and you realize that they need help and they desperately need treatment and want to commit to living soberly for the rest of their lives. What advice would you give them? What direction would you point them in when it comes to treatment and resources and where to get help?
So that's a great question, because when someone's ready, you want to seize that opportunity. People can change their mind. Life can change people's minds. And so when people are ready, we want to make sure that they understand where to go. So the first thing I would say is if you are helping somebody navigate this issue, go to Help Us Here. That is a great website that is going to have tons of information for you about where you can go. For most people who aren't clinicians, they may be a little confused about where to start. So what I would recommend is go to one of the bridge clinics throughout the state. We have one in each county. The one in Newcastle County is open later. The ones in Kent and Sussex are open during business hours. And that's a great place where you can walk in and talk to a clinician. They have psychiatrists. They also have nurses and peers who are in recovery themselves who can share their story. And we find that's really helpful in getting people to think about, like, is treatment for me? What's it going to be like? Here are the barriers that I have to going. Our peer specialists are amazing and can really help people think through whether that's a step they want to take. So The reason it's important to go to a bridge clinic or another type of treatment facility is that you need a clinical assessment. You need a professional to listen to you and help you think through your symptoms. They're going to offer a diagnosis, which crosswalks to a level of care. So what's a level of care? Level of care refers to what we call the ASAM inventory, right? So there's different levels of care. Detox or withdrawal management is the highest level of care. Then we've got residential treatment, we've got intensive outpatient treatment, and then we have sober living, or sometimes called recovery residences. So a whole continuum, right? And so people might start at the highest level and then flow down, or they may not need to do withdrawal management. They may be, could go to outpatient or something. So really depends, and that's highly dependent on the person, the substances that they're utilizing, what's happening with their mental health, any medical issues that they're navigating. So that's where it's really important to talk to someone who specializes in addiction medicine who can help you navigate that. And then the other issue, which I alluded to earlier, is insurance. So if you do not have insurance, the state of Delaware does not want that to be a barrier to care. And that's why we've invested over $40 million annually into free state-funded treatment. So if you don't know where to go, we have a great guide called The Guide to Accessing Publicly Funded Addiction Treatment that's also available on Help Is Here. You can go there. Once you find out what level of care is needed, you can look by county and cross-list there, and there's a phone number that you can call. So the bridge clinics statewide are more than happy to help people navigate that, because it's hard to know where to start. And so we want people to know that the state is here to support their journey, and if they have questions, they can certainly reach out to DSAM, visit bridge clinics, give us a call, and we'll be happy to help. So yes, we really encourage anybody. The most important thing when you are helping a loved one navigate addiction is to keep that open line of communication. It is critically important for people in recovery to have loving, supportive relationships. And so the best thing that you can do if someone in your life is struggling is to talk about it. And no pun intended, but talk about it. Have those conversations, show that you care, offer some practical supports, and maybe suggest to go with them to a bridge clinic or something like that, because showing that you care, regardless of where someone is in their addiction journey, we know that recovery happens in relationship with other people. That's really crucial.
Absolutely. Joanna, thank you so much for diving deep into addiction and treatment. Let's all give a huge round of applause to Joanna Champney, the director of DSAM. Thank you so much, Joanna. Appreciate it. All right. And now I'm going to turn over the show back to our hosts, Milan and Willow.
Thank you so much.
And now we have our youth spotlight.
Can Miss Soul please come up and talk about Miss Riley Pochito?
Watch the cord. My name is Sol Robles again. It's nice to meet all of you. First and foremost, I'm Lions as well. And I'm here because we are working with Noble Community again. The passion and the drive is to work with our kids and the whole family. And one of the reasons why I'm connecting with this beautiful family today and towards the future is because we're reaching out to the kids, and not only the kids but the family, the parents, right? We want to heal the whole family. And we have this young lady named Riley who has been participating, and of the many kids that are here, they're all looking forward to continue support and also wanting to participate. And we are to meet people where they are and ask them what their needs are. And I've been very fortunate to meet Heather along the way in our community, and Steve Collins, which is part of the Dads on Duty, and Moms on Duty. And so this mom and this young lady, and of course she has other sisters, are important to me because sometimes when you see the need in the community, right? I'm going to get emotional because it is really, really deep. When you see a need in the community and when no one else sees it, right, they feel hopeless, they're just in despair, they're anxious, they're stressed. How do you point them the right direction? So thank you for sharing about all of the different avenues which are reaching our community, including the Bridge Clinic. Riley's mom, Heather, has been that anchor to motivate me to want to continue to serve my community that I live in now for 16 years. So Riley started coming to summer camp with the other kids that are here and have been consistent. And there's days that they don't show up, and we're trying to reach out to them to make sure they attend. And, you know, just knowing them as individuals, right? Not just little people, little kids who we think always need navigation. We're learning from them all the time. So I want to thank Riley and her family for just moral support, first and foremost, and seeing outside of the box, and to continue to, come out and support us at the center during summer camp, just to say, hey, there are kids here who really want to participate and have activities in their community through outreach. Riley, you want to come up? Riley. So, Riley, do you want to say a little something about summer camp?
You might want to walk over here so the impact doesn't mess with the speaker.
What have you been doing? What do you like about summer camp?
Something I like about summer camp is the teachers are nice and we do fun stuff. Tomorrow we're going to make a candy salad, and we're going to have a movie night and pajamas.
Thank you so much.
Thank you. All right, give it up for Riley. Okay. Did you know kids who play sports are less likely to try drugs or alcohol? In fact, regular participation in sports reduces the likelihood of substance abuse by up to 29%.
Did you know kids who are consistently engaged in productive activities are more likely to have better mental health, as staying active and involved reduce stress and anxiety?
Did you know productive activities can significantly boost a child's creativity and problem-solving skills, which are critical for success in school and beyond?
These facts can help emphasize the importance of keeping kids engaged in meaningful activities that contribute to their growth and development.
Now we have a video break. The crew made 2 PSAs for tonight's show. Enjoy.
Opioid addiction is a serious issue affecting many teenagers today.
Clave, please. I'm trying to focus.
It starts innocently, a prescription for pain relief after an injury or surgery.
Your call has been forwarded to an automatic voice message system. 0, 1, 2, 3, 4, 5, 6, 7, 8.
But misuse can lead to addiction, affecting your health, relationships, and future.
Hey, are you okay? It's okay. I got you. I'm here.
If you or someone else you know is struggling, speak up. Talk to a trusted adult or seek professional help. You are not alone. Together, we can beat this. Opioid addiction.
Opioids are powerful drugs prescribed for pain relief, but misuse can be dangerous. What starts as a prescription can quickly turn into an addiction. Opioid addiction affects millions of lives each year. Opioids can affect anyone, even you. If someone you know is at risk, talk to a counselor, teacher, or parent. Visit samhsa.gov and 988 Suicide and Crisis Lifeline. Opioids.
Thank you so much, crew, for making these videos. And now we have safety tips for handling medication with Miss Hayat and I.
Hello, hello. How's everybody doing? Great. So, who's here is doing sports? Involved in sport. Who's here likes to be creative? Me. Right? As they showed us, that means you have positive things that you do in life that helps you reduce the likelihood of having addiction. So that's wonderful. So, what are we talking about today?
So we're talking about safety tips for handling medication.
Okay, tell.
So take prescription drugs and over-the-counter medications exactly as prescribed.
So why is that important?
Well, if you are taking a drug that is not over-the-counter, prescribed from a doctor, and just from some guy on the street, you're more likely to have, you could have an allergic reaction, or it could be laced with something that could kill you.
Exactly. So you don't know what you're allergic to. If you're taking someone else's medication, that is not prescribed to you. So that is a no-no. Only take medicine from that is prescribed to you. All right. What's next?
Do not share your medications with anyone. It is illegal and unsafe.
Yeah. Why is that?
Well, if you were to get a medication, share a medication with a friend or anything, you don't know if the friend's allergic to anything, or if you're just getting it from somebody else, the same reasons for the previous one, it's just not safe.
Yes. Actually, about 4 years ago, when my father died, my mother, this is in Ethiopia, she was crying so much she was having a headache. So my aunt said, I have a pill and looked like an Advil. She said, you can take one. My mother never takes medication from someone else. That night, she did. She had an allergic reaction, and at that time, my sisters were really scared at that time. So she had to go to a hospital and had to receive an injection. Till this day, my mom has an effect of that injection. So that story to say, it doesn't matter, this is a trusted friend or anything. You do not know. You do not take medicine from someone else. So if you have in school, go to a nurse. Doesn't matter that you trust your friend. So never take medication from someone else. All right, what's the next step?
Lock up all medications and keep them out of the way of anyone, including children or pets. Who might consume them by accident or on purpose.
This one is very important. Why do you think that?
Well, if especially little kids, they don't know better, and especially pets, they don't know what it is at all. So if they get into it, they don't know what's okay and what's not. They don't know how much to take. They don't know they shouldn't be taking it at all.
Okay.
So if they take it and they overdo it, or they just take one pill can kill, it could affect them immensely, or
Absolutely.
it could kill them.
Absolutely. So make sure you lock. You don't know who. As we're talking about, you don't know who is experiencing addiction. So your medication should be locked in your house. That's not in a vanity bathroom. Why is that?
Vanity bathrooms are easy to get into.
Yeah, people. So again, it could be construction worker, could be anyone that comes in your house can get into it. So that's a no-no. You take them. It's prescribed to you. Have it. This is for adults here. So make sure that it is in your bedroom, or nobody can easily access to it. That includes your kids. All right. What's the last one?
Safely dispose of any oh my God, I'm so sorry. Safely dispose of any unused medications at one of Delaware's prescription drug drop boxes or a deterra bag.
Yes, I have a deterra bag. You know what? We have a deterra bag. What do you think people do with prescription drug that is not they no longer use? Which, by the way, 70 to actually 80% of prescription drugs that people prescribe to, they don't sitting in their cabinet. So that's why we want them to dispose of it. And the deterra bag is available because not every area has a drop box. That's why we have the deterra. Very simple instruction. Put water in it, 45 pills. Then you can throw it away. But you do not. You know what usually people do with not deterra?
What?
Flush them down the toilet and throw them in a garbage. Why is that bad, audience? Yes, that is no. So this is environmental friendly. So if anybody wants one, we have them here. We distribute them. We give it to you. Just ask for it. Lastly.
Okay. Count it, lock it, and drop it.
Okay, what does that mean?
Well, if you have pills, make sure you count them, because if some people will have open houses and people will come just to take pills from your cabinets or anything like that. People will just, even family members will go into the places where they know that they are and they will take them. So make sure you're counting them and lock it away so that after you count them, nobody can get into it. And when you're finished with them, make sure to put them in
The Terror bag. So can the audience say it with us?
Count it, lock it,
drop it. All right, lastly, our last slide is, anyways, but at the end, it's just saying that it's available for you to use. Yeah, read that statistic.
Drugs can also be stolen or used by friends or family. Prescription painkillers or overdose deaths have increased over 400% since the year 2000. Almost 2/3 of teens who abuse painkillers can get their drugs for free from friends or relatives. And over half of teens say that they can easily obtain prescription drugs from their parents' medicine cabinets.
So parents, count it, lock it,
Drop
it. All right, that is all. Thank you.
Thank you so much.
Ms. Hayat. And now we have the outreach moment with Elena.
All right, now is the time for the outreach moment, which is when we take what we learned here and share it with people out there. And what we're going to do now is you can get out your phones and you can go on your social media. Now, no watching reels, guys. And we're going to post something that you learned about handling prescription drugs, and you're going to share it with somebody, and you're going to spread awareness on something that really matters.
Okay. Thank you, Elena. Are you having fun?
Are you between the ages of 12 and 18?
Well, if you are, join the
cause.
production crew.
Come on, we have so much fun here.
Yeah.
Like this event that we put together tonight, we did that ourselves.
Yeah.
With the help of our teachers, of course, but like.
Yeah, we can edit videos and we can act in them. And we go to all these different types of fun places and we get to do a bunch of different things. Like, what are we doing on the 23rd of September? Hello?
23rd? I'm pretty sure we're going to a youth leaders conference.
Well, where is that? Where's that at?
Dang, I forgot.
Rehoboth Beach.
I knew it.
Yeah, we're going to Rehoboth Beach on the 23rd of September, and it's going to be super fun. And we have
all these fun things happening.
Yeah, we have events like similar to that and like all throughout the year. Yeah.
So scan that QR code if you want to join the cause.
Now we have open mic. Oh, yes. Now we have open mic.
We haven't done that in a while.
Mm-mm.
So a quick refresher.
Open mic is basically a chance for you, the audience, to come up and tell a joke or a poem or a riddle to express yourself in any way possible. But
keep it PG.
Yes.
We have kids here of who knows how age.
Yeah.
So, keep it safe.
Yeah. So who would like to come up and express themselves? Okay.
Hello, everyone. It's me again, Jacob. As I mentioned before, I'm a member of the Cause production crew, and I'd just like to very briefly say a huge thank you to the Cause. I've been with the Cause for almost 3 years. I joined in November 2021. Reason why I'm saying this is because, as I mentioned with the interview segment, I will be going off to college next week, and I have a pretty tight schedule. So, sadly, I won't be able to be with the Cause as much. But whenever I can, I will drop by and see how they're doing. This is an amazing program for youth. As you saw on the screen, it's open to youth in this area between the ages of 12 and 18. We make PSAs, videos. I've produced documentaries. I made award-winning content, and it's really all through the Cause. So I'd just like to give a huge thank you to the directors of the cause, Mr. Scott Michaels, and Mr. Dennis, Mr. Lewis, all of the overseers, and of course, not only all the adults, but all the kids who I got to work with over these almost 3 years. I greatly appreciate it. I am so thankful for this opportunity. Thank you so much, cause.
Thank you, Jacob.
All right.
Who else
Anyone
would like to
else?
come up?
All right. Wait, that's his name?
My nickname is Bubba, and my real name is Louise. I'm here to express myself. I'm not gonna say a lot, but I really like sports, and I played for Claymont Elementary, and we won the championship. And yeah, I like basketball.
Thank you. Nice. All right. For example, could we all say our names just in case? You know, that would be real helpful. But like before you introduce yourself. Well,
Yeah.
as you introduce yourself.
Would anybody want to come up and tell like a poem or a joke or a riddle? All right. Well, if not, let's continue.
All right.
Can Alana please come up?
Alrighty. Yeah. I hope you guys had a good learning experience tonight, because this was so much learning and new things for me that I didn't know about before. And I understand that people who have problems, or just people who are not in the right mindset, need help or need to talk to somebody. I go to therapy. I've been going to therapy since I was in 6th grade, so I can understand that people need to talk about their problems or need help. So if you need help or more information about tonight, please visit helpusherede.com. And now, here's our host.
Thank you, Alana. You guys should follow our YouTube channel. Most definitely.
I mean, come on. You like us. That's why
Right?
you're here,
It's-
right?
It's us, right? You guys clearly were interested in us, which is why you're up here. So why not make it official?
How many subscribers do you have?
You know, don't we have like around 18K?
Yeah, to be more specific, 18.8K, almost 19,000 subscribers.
But it's not just enough for our goal.
Yeah.
Just
just tiny bit. We need 81.2 thousand subscribers.
that's just you know the number.
We want 100,000. And Lila, what do we get when we get 100,000
A
subscribers?
YouTube play button.
What was that?
A YouTube play button.
A YouTube play button.
Wait, YouTube play button.
Oh my God, I want a YouTube play button.
So do I.
All right, so
Help
let's
us
get it.
out.
Yeah, come on now. Everybody scan the QR code and yeah, follow us.
And speaking of our YouTube channel,
Yeah.
what do we do with our YouTube channel?
We post a bunch of videos.
We do.
You know a lot about that. How about you say it?
Okay. So basically, we post our videos, you know, YouTube. In fact, this is live streamed on our YouTube channel right now.
Yeah.
So if you want to, you can go back and see the monthly focus,
Yeah.
or you can watch the YouTube shorts we make of this
Yeah.
to highlight our favorite parts of the focus.
Yeah.
I think she wants to say something.
Yeah. Please subscribe to our YouTube channel. It would help us so much. Thank you guys.
And that's all, folks.
Thank you for attending, and join us next time for the next monthly focus on September 26th. Thank you so much.
We'll see you then.
All crew, please get up on stage.
I'm a rusty old boat hitch, and I am barely hanging on. See ya.
Applause for the monthly focus crew.